Welcome to WJRDoctors.com, Southeast Michigan's distinguished doctors.
Well, the Michigan Heart Group is made up of a group of full-service cardiologists and physician extenders who have been practicing cardiology for the past 20 to 25 years. We practice now out of all three counties in metropolitan Detroit. We have practice facilities in Oakland County, in Macomb County, and also even on the border of Oakland County and Wayne County. So we pride ourselves in being able to provide a full service of cardiology experiences for patients. We have cardiologists in our practice that practice general cardiology, but we also have specialists that are involved with coronary artery disease and coronary intervention, the catheterization, and more or less the plumbers of the heart. We also have doctors who deal with structural heart problems and congenital problems. We have doctors who specialize in heart rhythm disorders, both those that can be treated with things like pacemakers and those things that can be treated by fixing abnormal electrical pathways in the heart by procedures like ablation. When a patient comes to see a cardiologist, they're often encountering one of the most difficult times in their lives. In fact, many times the first day that we see a patient is the worst day of their life. Well, the value of a physician extender in today's world of medicine is that there's a tremendous volume of patients that are coming to see us that exceeds our capacity to be able to handle them all on a day-to-day basis. A physician extender helps us in the sense that we can triage various visits to their care. They become the recognition, the face and mind of the doctor that they work with. They help the patient sort through problems. They help serve as a vital communication link between the patient and the physician. Having well-trained physicians who have a wealth of experience, who are well indoctrinated in the Beaumont healthcare system, allows us to have access to a wide variety of doctors in different specialties and in our own specialty, so that we can do just those things. I mean, a patient needs to look for somebody who they can connect with, someone who will sit and explain to them what needs to be done, who will listen to them. To help understand a bit more about how the Michigan Heart Group operates, I think it would be important to hear from one of our founding partner, Dr. David Cragg, and how the electrical side of our business is operated.
I'm David Cragg. I'm one of the cardiologists here at the Michigan Heart Group, and I work with two of the other electrophysiologists at the Michigan Heart Rhythm Group. And together, the three of us work in a separate office adjacent to the main office where we have a special clinic, a device clinic, where we see patients that have defibrillators and pacemakers. So we're particularly proud of our device clinic. We have well-trained staff that's had years of experience in dealing with all types of cardiac devices. We have 4 specially equipped rooms that allow us to analyze all these devices. And so a patient that comes in that has a pacemaker or a defibrillator, we feel very comfortable that we can analyze the device and gather important information that we use when we see the patient in the office. With the patients, I think that cardiology, we're fortunate that most of our patients do very well with our treatments, and we developed long-standing relationships. I have many patients that I've seen for over 20 years. And I think that with the devices that we implant, sometimes the patients come back to us feeling significantly better in a short period of time.
Well, we're very fortunate to be working so closely in integrated fashion with William Beaumont Hospital. The Beaumont Health System is now a pioneer and a leader in cardiology. And this has been going on for the past 20 years. The reputation of Beaumont is national, not only local. And we have some of the finest cardiologists in the country working in the Beaumont healthcare system. I think that has benefited us in many ways, in that we've had the opportunity to be at the forefront of cardiology research, to be around some of the brightest cardiac minds in the country, and we've had the privilege to be integrated into a system that prides itself on camaraderie and collegiality, such that we can offer patients so much more. A complex patient may require a discussion between different cardiologists, and having those resources available, willing and interested in helping to promote the health of that patient is critical. And it's a true gift that we feel very fortunate to have. Beaumont has wonderful facilities and wonderful technology. We have now the ability to do the same kind of things in our office environment that are done at Beaumont Hospital itself. It's a little bit more advantageous, though, for our patients from a convenience standpoint to come and do those things in the office environment. So we feel very fortunate that we have the latest in technology at our fingertips, and that we have the ability to integrate so seamlessly with the hospital and some of the best cardiologists in this country, and provide not only great care for our patients, but also access to wonderful research and important new developments in medical technology. We are hoping that we can be of service to you in the future. If you have cardiac questions or problems, please don't hesitate to give us a call, 248-267-5050. Thank you.